name is Lorian Phillips. I'm a clinical psychologist and I've been in private practice for the past 20 years. It was only when my boys were diagnosed with ADHD and ADD respectively that I got involved in this field. So I have 3 children. My eldest son is almost 18, my second son is almost 16, and my daughter is 11 years old. My 2 sons both have various forms of the ADD diagnosis. My eldest was diagnosed at the age of 7 with ADHD, which refers to the hyper-impulsive kind of ADHD. My second son was diagnosed at the age of 5 with the inattentive ADD, the dreamy, unfocused, lost in their own world type of ADHD. I was very anti the idea of medication. When my brother was young, he was never medicated. It was seen as a stigma. There wasn't the understanding of ADHD that there is today. So I was like, no, they're not being medicated. And I was very into all the alternates. I tried lots of the Amigas and the Bach flower remedies and tissue salts and you name it. And my 5-year-old, who was the first one diagnosed, his nursery school teacher eventually said to me, "You've got a bright kid who's not going to make it into grade 1 if you don't do something." So at that stage I thought, okay, fine. Took him for an assessment and he started with his Ritalin. And the teachers were all saying, "This is too marvelous, this is too wonderful, what a change." As I say, for me at home, I didn't see too much of a change because he was quiet and he played Lego. I've since understood that medication is vital with many of the kids, certainly with mine. Some kids are able to get by at very low doses, some are able to just rely on Amigas or other supplements. For my kids, medication was absolutely essential. What I've seen is that, and what I might explain a little bit about is the role of medication, is that without it, medication helps your brains to function better, to focus better, to absorb the correct neurotransmitters that are needed in their frontal lobes in order to function effectively. But medications only go part of the way, they don't go the full way. The child still has to learn a whole lot of different skills and abilities in order to be able to perform effectively with all of the different issues that ADHD and ADD present. But so for instance, my second child, my dreamer, is far more focused in class with medication, far more able to concentrate. However, he still tends to be dreamy, disorganized, in his own world a whole lot of the time, which obviously has a huge impact academically, because if you're floating off from the classroom, you're not taking in the work. So that's his main behavioral aspect of ADHD, kind of being disconnected. I remember once driving on some long weekend to the Drakensberg, and we're looking out the window and the cows and hay bales and all the rest of it, all the context markers that say we're out the city, and he's dreaming his own world. He's about 8 years old at the time, and he says, "Mum, are we still on Rivonia Road?" And I laughed to myself. I said, "No, boy, how did you even get to thinking that?" And he said, "Well, you told me it's a very long road." So that's a disconnectedness, which, as I say, is very cute and appealing at certain times. So that's been his major characteristic, even now at almost 16, although he's a lot more switched on. My 7-year-old then, as I've said, his stuff was a lot of temper tantrums, outbursts, high anxiety, disruptiveness, jumping around the class, jumping around the home, creating havoc. So it was far more behavioral issues than just the concentration and the focus, and therefore unbelievably difficult to deal with.